As many as 60 million Americans have high blood pressure. That's about 1 in 4 adults age 18 years and older. Since this condition is considered a silent killer, getting the facts on prevention and treatment can save lives. We spoke with Dr. Rodolfo Batarse of Desert Regional Medical Center in Palm Springs to find out who's at risk.
Hypertension is an abnormal rise in the pressure that's seen in the vascular system of the body, meaning both the arteries and, by definition, the veins as well. It is taken and diagnosed by routine checks of the blood pressure with a blood pressure cuff or a sphygmomanometer. Target good blood pressure is the systolic, about 100 to 130, and systolic and the diastolic in the 70 to 80 range. Hypertension and persistent elevated blood pressure is detrimental to the entire body because the entire body has vasculature, has arteries that sustain this high pressure. So it is a risk factor for strokes. The vessels that feed the brain is a risk factor for blindness because the vessels that feed the eyes. Yeah, it's a risk factor for myocardial infarction, heart attacks. Those are the vessels that feed the heart. And of course, it's a risk factor for kidney injury and kidney disease in the very vessels that feed the kidneys. Most people wouldn't know they had high blood pressure unless they checked it. The first thing that needs to be done, and it's of utmost importance, is to diagnose it. And that means that physicians need to be looking for it, and patients need to go to physicians and have their blood pressure checked.
Dr. Batarse tells us how high blood pressure can be prevented.
Limit the amount of alcohol intake, stop smoking completely, don't salt food, increase exercise. Many people say, well, doc, listen, I'm not a triathlete. I'm not going to go out there and race. I'm not asking you to race. Exercise means 30 to 40 minutes of aerobic exercise. Could be walking, jogging, swimming, riding a bike, stationary bike, enough to get your heart rate up, enough to sweat. Do that 3 to 4 times a week at a minimum, and that's considered exercise for heart health, for vessel health. Those are very, very important. And it goes without saying that weight loss is a key issue. If a person is obese or overweight, weight loss is key. For every pound that someone drops in weight, the systolic, the top number, can drop by 1 millimeter of mercury at a time. So there is a direct correlation between losing weight and having better controlled blood pressure. But medications are available, they are oftentimes needed, and in the US, in people who also have kidney disease, most of the time, anywhere from 4 to 5 medications are needed to control the blood pressure. So it is not unusual to have that many medications given uniquely to control the blood pressure.
High blood pressure can be deadly, but the best medicine is prevention. Exercise and a proper diet can reduce your risk of developing this condition, or at least keep it stable. For the American Health Journal, I'm Laura Windsor.